So the listing, right? We need to understand the demand side and the supply side. So the demand side, what are the things that we need to see? Can I share my screen, Dinesh? Yes.
Yes, sir. I have given the co-host to you.
Okay. 1 minute, please. So, is policy background important for this question? Whatever you are going, because you as the program manager, now you are going to recruit some of the health personals for your organization or whatever your agency, your program. So for that you need to understand the policy background as well. So whether the policy allows you to recruit this sort of a personnel, so then it's important, because sometimes now in government sector we do not allow typists to recruit, right? We do not allow some of these the messengers to recruit. Likewise, the policy background is important even when you are going to recruit. So you have to explore whether the policy background is support your recruitment, right? And I think the jobs in the organization is important. What do you mean by jobs in the organization? What do you mean by, what is the definition of jobs? What is the job definition? Anyone? What do you mean by job? In the HR human resource point of view, if you take job, what do you mean by job? In a public health situation, for take example as MOH office, what is a job? Give an example. Now 23 are there. Are you there? All 23? Oh, Galapati ape Dakshila? Anything, any answer from your side? So jobs means any the tasks, right? Any identified task in your organization is defined as a job. For an example, giving oral polio vaccination is a task, right? Then if you take conducting school medical inspection is a task, but there are subtasks. So you can take measuring weight and height, and you check in eyesight, everything. There are different tasks. So any single task in a given organization is called job. So then you need to identify the jobs. So what do you think? Position is a collective number of jobs which one person can handle. So then the position, we recruit for the positions, not for jobs. Therefore, what is the position to the organization that achieve the strategic objectives? So when you are recruiting, it's important. It's called the strategic human resource management. I think you can hear me, right? All.
Yes, sir, we can hear you.
Right. Okay. Now, strategic. What you want to know is, so why we need to recruit some of the people? Because strategic human resource management is, you need to understand what are the main objectives of the organization. So, for an example, the organization's objective is to reduce the number of dengue cases and number of deaths due to dengue, or maybe the objective is to eradicate polio in the country, or maybe the objective is to prevent the reintroduction of malaria to the country. Likewise, your recruitment should link or tally with the organizational objectives of the that particular organization. Therefore, the position, you are going to recruit for a position. This position, you need to see whether this position, the task, the jobs of this position is directly related to the strategic objectives of the organization. And training Now, this is very relevant to the health sector, health minister of Sri Lanka. When you are writing your answer should be very focused, and it has to be tailor-made to the country context or tailor-made to the situation here in the country or the local situation, because general answers will not get the lot of marks. I think you will get more marks if you if you develop your answer focus into the local context. Why I have written here the training capacities. For an example, can you remember once in a I think about few years back, the government wanted to increase the number of nurses, very very drastically, where they want to increase the number of nurses. So what they did was they recruited a large number of or the very huge batch. So what happens? Our training capacities or the slots available in the nursing schools were not adequate for to cater for this particular batch. So then we need to open up the some of the we need to open up or convert some of the our other training institutions as nursing schools. The NIHS nursing school started like that. Therefore, it's important to understand, if we do the basic training for that particular group, we need to see or understand the training capacities and the slots are whether the slots are available. If the slots are not available, so we need to see whether there is a capacity to expand the search capacity or increase the number of slots in these training institutions. Right. So then, as you have mentioned very clearly, we have to see whether there are approved cadre for this, or if there is no approved cadre, can we recruit them?
Can't.
Anyone from? I think this is not a good time. You all to. Yes, Jayasilan, what do you think? Jayasilan, if there is no approved cadre, but still you want to get some of the personnel into a public health system. So what is the procedure?
Can we take them as contract basis?
Yes, contract basis. You can take them as contract basis. So then if you can go for a project and support from some of the donor agencies, so the donor agencies can recruit them for you on behalf of you to get done this activity for a short period of time. And also, if this particular activity, you are not going to hire this person, but you can outsource in that case, right? But if you want to actually increase the card or create a new card, have you heard about FR71? මුරේ 71 කියලා අහලා තියෙනවද? මුරේ 71 මුදල් රෙගුලාසි. So when you are creating a card, you need to prepare this format called FR71 or Murray 71 to, if you want to create a card, but it's a very lengthy process. And but still, if it is really need, so you need to go for a short-term measure like contract basis and asking for donor agencies to recruit person for this particular activity. And for the long-term basis, you need to go for recruiting this, right? And again, number of vacant posts. So the cadre approval there, number of vacant posts, financial allocations, yes. And successor plan for the organization. What do you mean by successor plan? Have you heard about this one? I just wanted to write this as well. What do you mean by successor plan?
Creating a second line.
Yes.
Creating a second line.
Yes, building the second line. Yeah, because usually what happens in the government sector, we do not have a plan for the people who are going to retire, because we know that we have to have a successor plan. So we know that these PHMs are going to retire in 3 years, right? Because we know that the PHM will be to produce a PHM, it will take at least 3 to 4 years. So then, so so the successor plan, the government should have a successor plan for all the cadres, and then this particular the successor plan also should be considered when they are planning their HRH, human resource for health. And the same time, you need to the successor plan is important, and the prediction also important, because now what is the most important thing in the health the health staff in Sri Lanka? What is the critical situation that we are facing with this HRH? Yes, migration. So you might get a question like that, right? How are you going to manage the deficiency that will face the health system in future due to this migration? So the migration we will discuss later, because migration we cannot stop. But what are the other alternative ways that we can, improve the health system with the available card, and how can the migration the migration of health personnel can be transformed to a win-win situation for the both the hosting country and the country of origin, right? What are the supply side? Now this is the demand side. So what we really want, right? So what we want. So we know the job, we know the position, we know the strategic objectives of the organization, we know whether there is a training capacities available, we know that the approved cadre, so vacant post and financial allocation and successor plan. Okay, we know that we will be losing so much of PHMs in coming 4 years now. These are the things that we need to think about demand side. Anything else that you have written or you think of, or you thought of regarding this particular the question or the first part? Anyone else?
So organizational things, can we take it as a different body?
Yes. What are the other areas that you what are the other points that you are going to discuss under this organizational area?
I thought that organizational things and environment, community involvement. So organizational ones, they depending on the particular authority or the body, there may be some specific rules and regulations like things in approving the HR.
Okay. Right, that's good. That's what I just want to write in the policy background, right? So the organizational background, yes, that's good. You can add the organizational thing. I think that organizational the aspect comes on the demand side, right? So if you want, you can have a separate the subtopic, or else you can include the demand side as well, right?
So I thought, in
Yeah.
addition to those, the population structure, the epidemiological and demographical data in that population where you want to recruit. Other
Okay.
than that, also what you said during our lectures, that within ratio is workload indicator of staffing needs. So according to that
Yes.
also,
Yes.
mm,
Good.
I
Good.
thought.
Right, that's good. The other thing is, now I have covered all these the vision ratio and the epidemiology, the community or the population epidemiology, and the demography, and the, as you said, this the community requirement, everything, the strategic objectives of the organization. Because your strategic objectives of the organization, if you can expand this one with all those the point, that's all good. But I think this is a 20 marks question, so we have to be very cautious in time as well. So that's all good. So you have to that's what the strategic objectives of the organization means, because organization want to cater. For an example, if you take the health ministry, we want to cater to the population. So then you have put the objectives based on all the information, like, vision ratio and your the community requirement, epidemiology, demography, and everything. Good. Anything else? Okay, then we are going for the supply side. The supply side also, as a manager, you need to keep your eye in, because when you are going to recruit people, if the supply side there are no available people for your recruitment, then your all efforts are in vain. Therefore, it's important to keep your eye on the supply side dynamics as well. So, for an example, once you can remember that during some of the time when we advertise for the recruitment for PHMs for different times, we didn't get adequate number of applicants for this. Why? Then we have not examined the supply side dynamics. So availability of suitable candidates in the job market is also need to understand when you are going to recruit, and also number of available in the training program. This is also important because, for an example, not the other cadres, but if you take doctors, doctors are trained by the different ministry, and they are being hand over to the Ministry of Health after they complete their training. So what happens is, when you are going to recruit, for an example, if you want to improve the primary health care services, put in 2 doctors, so 3 doctors in all PMCU. For an example, if you think that you are going to plan a primary health care institution in the country, put in 3 doctors. So you are going to recruit the number, increase the number of health personnel. But if you want to see, same time, you want to see whether the adequate number of people are in the pipeline of training. And also other labor market trends and forces, like, the push factors and pull factors for migration, and any other, for an example, if you take that, why the PHMs are not coming for this, they are not taken up for this post, because there are other jobs which, for quote unquote, so-called what can I say, that කැන ටයි දාගෙන මේ ඔෆිස් වල ඉන්න පුළුවන් පෝස්ට් තියෙනවා, rather than හොඳට ඇඳගෙන ගිහිල්ලා ඉන්න පුළුවන් ඒවා තියෙනවා, but they may not be paid much salary, but still තරුණ ළමයින්ට එහෙම ගිහිල්ලා ඉන්න පුළුවන්, rather than going house to house and providing domiciliary care. Likewise, the labor market trend also you need to pay attention in this question, right? Okay, anything else? Are you with me, or are you sleeping, opening the Zoom?
Shall I go to the second question, sir?
No. Wait. 1 minute, please.
So number retiring, you don't have to mention it separately, is it like that? Does it come in under some other category?
Yeah, I put this as a successor plan of the organization, but if you want, you can put that as well. Successor plan include all those things: retiring, going, then there are the categories. For an example, for doctors, so you know that senior admin grade will filled by the junior administration. So the on not only retirement, but also promotions also will keep the lower grade post vacant. Therefore, the successor plan, I include all those things, but yes, you can expand like retirement, promotion, and so on and so forth, right? Okay. Right. Yes.
So the availability of the different specialities, I mean, not the number in the training programs, but the availability of the different types of specialties in, is that we
Yeah.
can?
Yes, you can mention that also. You can mention, and yes, okay, availability of train programs. So these labor market trends and forces. So then labor market, have you heard about labor market? health labor market analysis. There is a separate report called Health Labor Market Analysis in Sri Lanka in 2018. Have you seen that? No? Right. So the
No.
labor market, just what labor market analysis, there are, especially the production. So they have three main pillars: the production, and also the main trends and the service delivery. The production category, there are production pillar ke තියෙනවා. So what do you mean? How many number of the candidates you recruit the universities, number of the candidates recruit to other training programs, and so on and so forth. And then these train the people put into the labor market. So the labor market, the trends or the dynamics, what are the dynamics? They may get the appointment in the system, they will leave the system and they will change the job, or they will migrate, or there will be out migration from other country to Sri Lanka, and so on and so forth. Then the labor market component. After that, the health delivery component, what we see in the health delivery component, with the available number of these staff in the labor market, how we are going to provide the health services. That's where we discuss labor market analysis, and these three pillars we need to elaborate, and we have to understand thoroughly if you want to make good prediction and good labor labor force in the country and the system. Okay. So the number of the different, the specialties also can be taken separately. I have taken here in the labor market trends and forces, because the production component that will cover in the production component, right? Okay, the 4.2, the question is, the question is how the job description.
Discuss flow job description will improve. Discuss how job description will improve the performance of the public health personnel. 30 minutes.
Right. Okay. So this is 30 minutes question. 30 marks. So and you have to pay attention. This is discuss. So the discuss means you have to discuss both positives and negatives, pros and cons, advantages and disadvantages. And before that, I think it's important if you can put some definition. So the job description. What do you mean by job description? So if you can't remember the exact definition, just put some word and make it as the definition. So then do not mention as definition. Then start the job description means Kiela, you just write something which is which will give some meaning or the summarized meaning of that particular word. Therefore, it's important to start with this introduction. So with this, so that's important. If you have a proper definition in your lecture notes or somewhere, that's important if you can put this definition first. So what is job description then? Have you had job descriptions in your organization when you are working?
Yes.
Yes. Yes, Amali. Where did you work the last?
Last after the MSc, I was at Southern PD
Okay. Okay. As
MO Public Health. MO
MO
Public.
Public Health. Right. MO Public Health. Did you have the job description there?
There actually we didn't have any specific job objectives.
Job description, right? So the job description usually it's the mandatory requirement for all these categories to have a job description. It's the duty of the head of the institutions to ensure that all these categories will get their job description correctly on time, right? So that's a document providing information regarding task, the duties, responsibilities, and their, authority levels and so on. So usually job description contain the title, job title, what is your title, and the preparation date, because we can have the revised job description after a while. So it's better if you can have preparation date and the version as well, and the prepare who prepared this one, because it's important to know who has prepared. You need not to go through all those things, but I just want to elaborate on this, the content of the job description, because then you will understand the importance of it and how it can lead to the performance of the work. So the job summary, general nature of the job and major functions and activities. And this is important, the relationship. So where you have been put in the organization chart, because who are your supervisors, who are your the immediate reporting officer, and who are your supervisors, and who will you are work with. That means your subordinate, your colleagues, or your parallel workers, and also your subordinate as well. So this is actually not really related to the government, because any worker, they can't write they can't contact the other organization without going through the proper channel. So the responsibilities and duties also important. So it's very clearly mentioned your duties, the jobs, the tasks. And as I said earlier, the jobs are the tasks of the organization to fulfill a particular activity, particular objective, or particular. It has to be very specific and very identified activity will be fulfilled in this job. So the number of the collection of jobs will make a position. Therefore, this person will get the number of duties and responsibilities, because he has been recruited for a particular the number of tasks. So then it is called position. So now the responsibilities and duties, the major responsibilities and duties, and decision making authority, and who will the decision making authority, level of authority actually. So what are the authority level that you have, and direct supervision, budget limitation if you have, because not for the junior categories but senior categories, the authority levels and the budgetary limitations are important. You know that even for the procurement, there are different authority levels for the senior officials. So according to that, they can go for the procurement. Otherwise, you have to go for the senior or higher the procurement committee. Likewise, these authority levels and the budget limitations are being highlighted in the job description. And standard the performance and working conditions. So usually the do's and don'ts are not really mentioned, but usually the cultural factors of this organization will be mentioned. But in government job description, not all those things, we can't see all those the items. What they especially we have seen the job identification, title, preparation date, and who prepared this one, and job summary and relations and everything. But the end, you have seen that and any other duty that may be assigned. So that's assigned by the senior official, the supervisor. So that is called expanded job description, because any given time, so this job description, other than the jobs assigned in the job description, they are bound to do the any other duty, any other activity assigned to them by the authorities. Right. Performance is the manner in which the employee performs pursuant to employment, and includes analysis of the employee attendance at work, attitudes, effort, knowledge, and behaviors and skills. Right. What are the advantages of having job description to improve the performance? So you have mentioned most of things in your answer script. Yes. So the tasks are very clearly identified and they are very specific. So then it's easier for us to perform and also to assess the performance. So because they are taken as indicators as well as you mentioned in the answer script. So clear demarcation is there. So no overlapping and no confusion or conflicts between the areas. So the any between some of the other employees and decision-making authorities given. So you have given the decision-making authority. You are authorized to approve these things. You are authorized to approve. You are authorized to approve. You are authorized to approve. For an example, if you take procurement of 300,000 or 200,000, 500,000, likewise. So chain of command is very clear. So you need not to worry about to whom you are going to report, and it's very clear. And supervisor is allocated. You have a supervisor, and you can get the if there is any doubt, you can get clarified with your supervisor. And therefore, this entire process, entire job description is pro for the performance, improve the performance. Therefore, the other one is for the organization, it's important at a given point of time to increase the search capacity of their workforce. So they may assign some of the other duties to the job description, the task mentioned in the job description. Therefore, it's important to have this expanded job description. So the expanded job description also can support to improve the performance. What are the disadvantages? Do you think what are the disadvantages? What are the disadvantages?
Normally job description is normally it's prepared for around 5 to 10 years. But the thing is that within that duration, the requirement can be changed, but according to the job description, we can't change it.
Okay, good. Yes, but the job description, that is the disadvantage, but it is not the disadvantage of having a job description, because it's not a limitation of the job description, because job description has to be revised periodically. So if it is not done, it is the responsibility of the organization, the authorities. Therefore, I think that the job description per se, this is not a disadvantage of the job description. Job description, if there is a change in the job content, the context, and the technology, and if there is a change, definitely job description has to be changed. I can give you a good example on this. Now, do you know how do you earlier days when they are doing this when the MLTs are doing urine අර මොනවද බලන්නේ අර CKD වලට අපි බලපු ටෙස්ට් එක මොකක්ද එකක් බැලුවේ
microalbumin
CKD වලට මෙහි අපි මෙහි අපේ national policy එක තිබුණේ පුතා මෙහි කොහෙද මේ අනුරාධපුරයේ තිබුණේ USCRද yes, urine albumin creatinine ratio, right? USCR. So what happens was the earlier days before this the auto analyzers comes, the MLDs were doing this manually, right? They were paid කෑලි 3කට pay කරනකොට albumin බලන්න වෙනම pay කරනවා, creatinine බලන්න වෙනම pay කරනවා, then තුන්වෙනි කෑල්ල තමයි ratio එක බලන්න වෙනම pay කරලා, so කෑලි වලට pay කරන්නේ. But once the five-part auto analyzer comes, everything comes in a second in this particular through this machine, right? Still the job description is the same and the payment are also the same. So it's our duty with the technological improvement to revise the job description and maintain the the job description up to date. Therefore, yes, if it is not updated, it's not a fault of the job description, but it's a fault of the authority. Yes, we can take as a process limitation. If we have not updated it, that will be a disadvantage. Okay, good. What else?
People tend to limit to the job description.
Yes, yes. So the people, like, sometimes nowadays, most of the time, so අපි මේටික විතර අපේට ලියලා තියෙන මේටික විතරයි ඒක විතරයි කරන්න කියන එකට යන්න පුළුවන්. ඉතින් ඒකට තමයි අපි ඔය organization cultures build කරන්න ඕන කියන්නේ. So usually that's a duty of the organizational manager or head of the department. They have to develop a culture where all the employees have to work towards the strategic objective of the organization, not limiting to the job description. Yes, there will be some issues like that. What else? Anyone else? I think all are.
If the task and the duties in the job description is overlapping in between several categories, that can may lead to the union actions, trade union actions.
Yes, yes. Again, it is again, yes, but it is again, then when may පොඩ්ඩක් පුතා මේවා ලියනකොට ටිකක් focus වෙන්න ඕන, because what they have asked about the job description. So yes, if they have prepared the job description which is overlapping the activities of two categories, that's the issue of whoever who has prepared the job description. However, yes, that can be lead to the union action. I can still give you some of the examples that we faced this regarding this. Okay, anything else?
Sometimes when the job description is there, the delegation of work also being little bit difficult.
Yes, that's also there, because though there is expanded job description to say that to any other duty, yes, some the people say that but it is not in a government servant. So according to the chain of command, we are bound to do this. So, but yes, there will be some of the issues. And as you said that the earlier that one of the doctors here, you mentioned that if it is not updated according to the context, that also an issue, because then if they will say that they will adhere to the old description, right? Yes. What else? Right, that's all, because I think this is a 30 minutes question, and I have seen in your some of the scripts, so the redundancy or unnecessary words are there. So don't waste your time to write unnecessary words to your answer scripts. Write to the focus. Think a little, think a while before writing, and organize your answer. It's better if you can organize your answer into the different, අපිට බෙදා ගන්න පුළුවන් නම් හොඳයි. And so it's better if you can put this whatever your sketch at the beginning, then you fill the answer below the sketch, and so then you will get more marks, and you can develop a comprehensive answer, right? Okay, the last part of the question. What is the last part?
4.3, describe how a consultant community physician planning will assess the need of capacity building of the public health team at provincial level. 50 minutes.
Right. So this is a description, right? This is your description. So the description means you have to describe in detail, and how are you going to do? Okay, shall we start? What do you think? First, what is the first thing that we need to understand or identify before going to assess the training needs of these people?
First, we have to introduce who is the CCP and his main roles as the first sentence.
Dinesh, I don't think that yes, that's all good. You have to just give an introduction. But
Capacity
here,
building.
huh?
Capacity building. What are the areas?
I think rather than giving introduction to the CCP planning, no, uh, and understand this question specifically focus on your practical exposure and practical way of thinking when you are going to start when you are starting your work as CCP, right? So here, rather than theoretical aspect, they are looking for your application, ability of application of your theory. Therefore, I think it's better if you can, write, giving some example as well, such as like, එහෙම කියලා පටන් අරගෙන ලියන්න ඕන. Yes, capacity building ලියනවනත් හොඳයි. මං හිතනවා මෙහෙම එකක් ලිව්වොත් හොඳයි කියලා. Provinces එක ගැන පොඩ්ඩක් බලන්න province එක මෙහෙමයි සිද්ධ වෙන්නේ කියලා. Because you are the provincial CCP planning. So there are several other questions I have seen. They have asked to describe the CCP planning's roles and duties and responsibilities and so on. So here the focus is not on the CCP, but here the main focus in the developing. Oh, what's the question? 1 minute, I have that.
Describe how a consultant community physician will assess the need of the capacity building.
Right. Assess the need of the capacity building. So then we have to focus on this particular assess the need of the capacity building NISA. Right. Capacity building to our our health staff who are working in the province. So what is the main? You are a CCP planning now. So you have been asked to develop the to identify the capacity building needs of your organization. So what is the first thing coming into your mind?
What are
Can
the
we
Categories.
Need analysis.
yes?
what are the needs in
Who are the
province?
categories that we need to?
Okay, categories. Okay. Always think strategically because you have been appointed to. Why you have been appointed as CCP planning? හරි. government එක අපි recruit කරන්නේ මොනවටද ඇත්තටම? health ministry එක අපිව ගන්නේ ඇයි? In general, එහෙම හිතුවොත් as a broad spectrum, broad aspect again, if we think why the government recruit us as health professionals, why the Ministry of Health recruit us, INSA start and develop your process, develop your answer based on that. Because හැම වෙලාවෙම හිතන්න we have been recruited to fulfill or achieve the objective of the government. එහෙමනේ. දැන් අපිට තියෙනවා නම් Ministry of Health එකේ objective එකක් achieve කරන්න ඒකට තමයි අපි හැමදෙනාම recruit වෙන්නේ. ඒ නිසා first of all අපි කෑලි වලට කැඩිලා යනකොට පහළට යන when you are going down, so the main objective will divide it into sub objectives, sub strategies and the things. So the provincial level the implementation, most of the implementation part will take place in the provincial level. Therefore, the provincial level the implement when the organizational objective, organizational strategic direction. Therefore, you need to identify first what are the organizational requirement for us to or the deliver the service. Agree the Are you?
Yes.
Are you? Yes, because එහෙම නැතුව training needs identify කරන්න බෑ. So what is the real the requirement of this particular, what is the skill needed to achieve the strategic objective, right? Okay. Therefore, when you are capacity building first a gap එකක් identify කරන පළවෙනි එක what are the capacity of ඕන. The capacity එක මොනවටද කියලා බලන්න එකට අපිට important to write first to understand why this skill or that particular person is really the needed. Therefore, to identify, the first thing is to identify the strategic objective or the strategic direction of the organization. It's a general term. අපි ලියද්දී එතකොට describe කරන්න තියෙන. එතකොට අපි කියනවා provincial health department එකේ for what are the priority areas for the health the delivery, or what are the priority areas in health services improvement. Is there any other priority area? For an example, sometimes with some the project, the primary healthcare may be the priority. Likewise, what are the priority strategic areas in this province? ඒක identify කරගැනීම පළවෙනි කාරණා. එතකොට the same time, this question you have to divide into two, because there are two factors we need to consider. One is the organizational factors, the other one is the person factors. So we'll see what are the organizational factors. One is that the gap එක identify කරන්න ඕන නම් අපි දැනගන්න ඕන මොනවටද gap එක මේ මිනිස්සුන්ගේ skill එක ඕන. එතකොට skill එක ඊට පස්සේ අපි දැනගන්න ඕන මොනවද අපි ඊට පස්සේ කරන්නේ. What are we going to do? Then what? Now, organizational aspect again, you know now these are the factors that we need to or improve the services. For that, by the way, if you want to establish a service, what are the aspects that you need to do? Aspect you need to pay attention in the province, in organization. Yes.
Category who need the capacity building and who do the capacity building, what form you
Right.
will do and where.
Right. Very good. Very good. Right. Now we are going to assess the gap. So gap for what? Then gap එකක් කියලා කියන්නේ මොකද්ද? What is the problem? Gap එකක් නම් මොකද්ද තියෙන්න ඕන? Are you with me or are you sleeping now? Just opening the Zoom or entering into the Zoom. Okay. Gap එකක් කියලා කියන්නේ if you want to there are two stages, because the stage that you want to go and the stage that you are in currently at present stage. So there is a gap. So stage that we are going to go කියන එක කොහෙටද අපි යන්න ඕනේ කියන එක decide වෙන්නේ what is the skill or the capacity you want to deliver this service නේ. Therefore, first of all, you need to identify what are the objectives or the services or whatever the things that you want to deliver. So this is the stage. So if you don't have this sort of a skill, now you have to identify what is the current state, as you said. So then you will identify what is the task and who are the categories of this personnel we need to improve. We need to get the involvement to fulfill the task. Okay, are you with me? Are we following a certain flow? Yes. What is the task and who are the categories of people who need their involvement to achieve this task or to deliver this the service. The second, right? As you said, the categories. Then මොනවද අපි බලන්නේ? Categories වලින් පස්සේ මොනවද අපි බලන්නේ? දැන් categories වල task එකක් තියෙනවා, categories ටිකක් තියෙනවා. දැන් categories වල මොනවද බලන්නේ?
Priority
Who will do the
areas to
training?
do
What
that.
type of training? Training of trainer, TOT or the training? Who will be doing that and what
Right.
for?
That's also important. Why now? Then you need to understand how the number, right? Number of people who you have identified in the categories, there's a number. If the number of the people are very big, then can you go for direct training? Capacity building එක කරන්න පුළුවන් ද ගොඩ දෙනෙක් ඉන්නවනම් හැමෝටම කරන එක වර්ධ නැහැ. සමහරලාට අන්න ඒ වගේ වෙලාවට තමයි අපි TOT එක select කරගන්නේ. So you have to specifically mention the number of people who need capacity development. So all the PHMs in the area, if you want to train by yourself, so that's good. But it is not efficient because you will take time. That will take time to complete the entire the cohort of your PHMs. But if you do the training of trainers, TOT program for the SPHNS or SPHM and PHNSs, and asking them to do the training for all the PHM. So you need to decide whether to go for the direct the training or the capacity building programs, and whether to go for the TOT. Therefore, the number is important. Then you have to identify the exact skill you want. For an example, whether this is the knowledge, you need the practical skills, and whether you need the attitudinal change. For an example, because අපි හිතමු අලුතෙන් අපි ආරම්භ කරන්න යනවා service එකක් in a particular district, particular the PMCU, you are going to start the NCD screening program. So the NCD screening program, you need some of these capacities for these health staff. What are the categories you are going to involve? You need a nurse, you need a doctor, and you need sometimes the MLT and phlebotomist or something like that. So then, what are the skills, the knowledge gaps, and the skills needed? For an example, if you take the what you call the NCD screening, if they have the adequate knowledge on counseling for NCDs, then that knowledge, knowledge එක තියෙනවද නැද්ද? ඊට පස්සේ knowledge එකට වෙන ඒක ඒ පැත්ත. The skills වලට ගත්තොත් specifically the phlebotomist, do we have adequate number of phlebotomists to draw blood? And if not, if the nurses are not adequately available, so then are we going to train අපි හිතමු ඉන්න කාව හරි blood ගන්න train කරනවා නම්, so do they have adequate knowledge and the practical skills to blood? Then, so we have gone to think whether the objective or the service or whatever the organizational need. Then involvement of the categories. Then the third one is how about the numbers? Then you will develop their profile. For an example, if you take this profile, you will get the PHMs, PHNS, SPHM, PHNS, and MOH or something like that. So may I get දැනට තියෙන skills, knowledge, skills, ගැන you will develop a profile, maybe with your existing knowledge or with a simple the data collection measure like questionnaire or checklist or something like that. So you will understand what is the existing knowledge and skills that they have. So then you will compare with this existing knowledge and the skills with the required knowledge, skills, and attitudes. If you think that you need to improve this one because it's not adequate, then you will develop your capacity building program. The meanwhile, this is the core component of capacity development or the gap analysis, because gap is the existing thing and the required level. So you will identify the gap. So with the gap analysis, you will get the other information for the relevant information for conducting training programs. For an example, if you think that you are going to do the training programs online, then you need to know how many of them have the smartphones, laptops, and facilities at their home or their offices to run the online training programs. And they are on the IT capacity, so IT knowledge and skills on to participate online training programs. And their preference timing, මේ වගේ රෑමද කරන්න ඕන. එහෙම නැත්නම් උදේ කරන්න පුළුවන්. Likewise, that's important. So and it was එහෙම නැත්නම් hybrid measure එකට යන්න කැමතිද? And adult learning වලට අපි මොනවද කරන්න පුළුවන්? Likewise, parallel, but they are not really the main gap, but other information need to be gathered because you are the person who is going to develop the capacity building program for them. So the gap as well as other the background information is really needed. Okay. So for that, then you will do this gap, the component. This is the main component. And at the same time, you have to describe how you are going to get the because you are the CCP, only one person, but to gap analysis, it's better to have a team of experts to develop the required skills and required the knowledge level for that particular activity identified. Therefore, it's important for you to appoint an expert and a group of people with work with you to identify the expert levels and so on, right? So what are the needed activities and so on. Likewise, then you need to get this approved from the provincial director, and then you will apply this data collection measure, and you will compile this information. Then you will write the report, and finally with the report you can develop the capacity building program according to the levels of their knowledge and the things. Then you have 3 different things. One is the main component of the gap analysis and your administrative process and the background information that you will gather to complete your task, because you will do the gap analysis to develop a capacity building program. Okay, right? Are you with me?
Yes. Sir, when I
Okay.
come to this question, sir,
Yes.
it described how a consultant community physician will assess the need for capacity building. If we
Yes.
write how the CCP assess the capacity building through surveys, from a survey, from a questionnaire like that is.
That's right. That's right. Because this describe me dimension තියෙන්නේ. ඒ නිසා තමයි මං කිව්වේ capacity building එකක් gap එකක් identify කරන්න නම් මෙන්න මේ ටික අපි identify කරගෙන ඉන්න ඕන. එතකොට ඒ ටික තමයි අපි මොනවටද මේ gap එක මේක කරන්න යන්නේ. එතකොට මේ gap එක identify කළා. එතකොට අනිත් පැත්තෙන් අපි කරනවා process එක. එතකොට I as a CCP planning will form the expert group within the province in order to complete this activity. එතකොට තමයි අපි ඒකෙන් තමයි what are the required skills, knowledge and the attitude of the මේ කාගේද මොනවද ඕන කියලා අපි දැනගන්නේ ඒකේ. So what are the required who are the required categories කියලා දැනගන්නේ ඒගොල්ලන්. Then you will get the permission of the administrative authorities. Then if required, you will develop the data or the data collection method, like surveys, maybe interviews, maybe checklist and so on. So you will do it. So with that, you will understand, you will develop the profile of each categories of their, they are දැන්ට තියෙන ඒගොල්ලන්ගේ knowledge එක මොනවද, දැන්ට තියෙන skills මොනවද, සහ required skill එකක් තියෙනවා නම් ඔයගොල්ලෝ හිතන එක දැන්ට තියෙනවද, ඒක නැත්තම් නැහැ. So then you have a profile, you develop profile. So then you have a developed profile of these particular people, which was done through a survey, maybe, as I said, any data collection method relevant. Then you have the expert group has decided what are the things really needed, and you have a gap. So then for that gap only, you will develop the capacity building program. For this particular question, yes, how the CCP do the gap analysis, you need to write main 4 component which I was discussing earlier, because මූලික ටික ලියනවා gap එක කියන්නේ මොකද්ද gap එක analyze කරන්න යයි sorry gap එක identify කරන්නේ කොහොමද gap එකයි මේ gap එක නෙමෙයි මුලින් මොනවටද මේ knowledge එක අවශ්‍ය කියලා then you will write the process administrative process how you are going to do okay Dinesh
Yes, sir. Thank you.
anything else okay right what is the second question the other question
The primary 2017 paper 2 question 2, the primary health.
එන්නන්න පුළුවන්ද මට
So question
අමත් දුන්නවනේ හරි මම බලන්නයි කොහොමද
I'll share the screen, sir.
all right okay
2017 paper 2 question 2, primary healthcare is defined as essential healthcare based on the practical, scientifically sound, socially acceptable methods and technology, and
Okay.
made universally acceptable to individuals and families in the community through their full participation. 1 point.
okay
Briefly describe 5 deficiencies of the present primary healthcare services. 50
Okay.
marks.
okay right what is the second one describe how
Second,
Provincial concern.
how province CCP planning will contribute to the strengthening of the primary healthcare services in the province 50 minutes.
hari hari පළවෙනි එක කොහොමද ඔයගොල්ලෝ ලිව්වේ මොනවද ලිව්වේ who wrote this question අත උස්සනවද කවුරු හරි ලියපු අය no it's written right in MDs there is no spoon feeding කියලා තමයි මට කියලා ඉුවේ මේ කවුද sir අවුරුත් ලියලා නැහැ නේ කෙනෙක් ලියලා level තියෙනවා මට but all right okay so tell me one by one so මම අහන්නන්නේ නැත්තම් නිදිමතයිනේ කට්ටියට right okay Pujani
Yes, sir.
so how are you going to structure this question or answer
Sir, my answer has sent to you, sir.
all right very good I saw your answer right okay what are the areas Pujani
So I structured it as a technology and a community care and accessibility practices, community participation. Like that, I divided the
Okay,
primary
good.
care.
right so in primary care because they have given the what they have given they have given all the definition right definition එක given නේ නේද ඒ හින්දා අපිට බලන්න පුළුවන් ලංකාවේ සිස්ටම් එක ඇතුලේ මේ definition එකේ තියෙන කෑලි වල තියෙන අඩුපාඩු මොනවද කියලා එහෙම නේද හොඳ ඒකම තමයි මම හිතන්නේ පූජානිත් ලියලා තිබුණේ areas විදියට ගත්තාම ඒ කියන්නේ technology මේ පැත්තේ කතා කරන අපි මේක කියන්නේ sounds technology and acceptable sound methodology and ethics right okay starting from the accessibility and availability of primary healthcare services in Sri Lanka what do you think any deficiencies
Accessibility is a problem in some part of countries because still the roads are not developed well like that. Can we start like that?
okay
They
then
just-
primary healthcare yes yes, now the primary healthcare they have given the definition here and I think it's better if you can start from if you can give a brief introduction for the primary healthcare system in Sri Lanka right so what you are going to write about the primary healthcare system in Sri Lanka so
It's a small thing, sir. When,
yes
when they are asking the briefly describe 5 deficiencies, do I have to give the introduction also, or can
That's-
you go straight away and write the 5 deficiencies?
because 5 deficiencies ලියන්න එක හොඳයි yes මම හිතන්නේ මම personally හිතනවා if you can give a brief introduction to the system because they know that you know the system right If you know the system only, you can go for උදාහරණයක් විදියට දැන් ලංකාවේ primary health care දෙන්නේ කොහෙන්ද? දැන් you had to write it. Right. Though there is no primary curative care or the primary the preventive care කියලා එකක් නැහැ primary care වල. Is there anything in the definition? මම අහන ප්‍රශ්න තේරෙනවද ඔයාලට? In Sri Lanka, not in the Sri Lanka, but in general, is there something called primary preventive care, primary curative care? Theoretically, is there something there's any division between this the primary care?
Yes, the care is same, sir, but they have divided curative sectors. Divisional hospitals and PMCUs is around around 474, and the MOH office 340 or something is there.
Yes, Puta, that is the institution, the facilities you are talking about, right? So I'm asking, in general, the concept of primary care, is there a division called primary curative care, primary preventive care?
Primary curative care is provided by primary curative care is provided by the
No, I'm not asking for the provider, Puta. I'm not asking the provider.
By
Mama,
definition,
in
yes,
the
sir.
concept, okay, is there anything?
Yes.
Huh?
Yes. Theoretically, yes, there is a division.
Theoretically, is there a division? No, not.
Theoretically, no.
Theoretically, no, right? Theoretically, there is no. Theoretically, there is no division, right? Theoretically, there is no division. But in this country, because of several reasons, we have differentiated two the arms of the primary care, like primary the preventive care and the primary the curative care. What happened was that when the primary healthcare development project, that is PSSP, comes, we came in this about 5 years or 4 years back. So the preventive care people, they didn't want to touch their system by the project. Therefore, they took over the primary curative care component for their project. Therefore, the primary curative component came into the action. But theoretically, in general, I don't believe that there is primary preventive and the primary curative care system, because preventive care is the whole entire spectrum of health services given in the primary setting. Right. As we said, that the primary preventive care will be provided by this MOHS office, and primary preventive care services are provided by 500 odd PMCUs and
Divisional hospital 400.
divisional hospitals. What else? What else?
Those are the two categories in curative sector, sir.
Is that all?
5 categories they have mentioned.
What are the other
Private
categories?
sector.
Okay. In the health, the government sector.
State sector.
Okay. State sector, yes. Primary preventive care, the PMCU, DS, the DH, and
Secondary and tertiary care.
care වල මොනවද?
OPD.
OPD and clinic services නේද? So the most of the OPD and the clinic services they are taken as a primary care services provided by the higher categories of hospitals. An example, teaching hospitals, base hospitals, and all other hospitals. Therefore, you need to write this, the curative health services is provided, yes. And although that we have not paid our attention and we don't have a proper control over, but the primary sector, the private sector also, played a very big role in providing primary curative care in the country. What is the percentage of OPD coverage by the private sector? Sri Lanka? PD visits වලින් කොච්චර private sector එක කරනවද ලංකාවේ?
50%. Around
Yes,
than
50%.
50%.
More than 50%. More than 50%. More than 50% කරන්නේ OPD කරන්නේ private sector එකේ නම්, is it an important sector in the primary care?
Yes.
Yeah.
Yes, though we don't have a proper regulatory or control mechanism with this, or the coordination mechanism with the primary curative care private sector, but still they are very important. They play the important role. Okay. So, right. Then you write the brief description like that. So what are the things? If we'll take one by one word by one. Practical, scientifically sound. Is there any issue in our practice or our guideline protocols in the primary care? When you are writing the issues, right? Primary care එකේ දැන්ට තියෙන ඔයාලා දකින්න deficiencies කියනකොට start with the big ones. Right? Start with the very the important ones and go to the other ones later. I don't think. What do you think? In Sri Lanka, who man the primary care institution in Sri Lanka now?
Yes. True.
කවුද දැන් අපේ PMCUs වල ඉන්නේ who man these institutes?
doctors, RMOs.
RMOs, the very few institutions they have RMOs, because we know that RMOs are dying category. We are not recruiting them more further. So therefore, all these the PMCU will be replaced by the MBBS doctors. So we know they are training, and we know that they are very competent, and therefore I personally don't think that we have a big issue I know that there are some here and there are different practices according to their but still I don't think in general there is a issue regarding their the evidence-based practice. What do you think? What's your opinion? What's your opinion?
Normally, they are
Service availability is low, but they are doing evidence-based notes. Even though they are giving restricted services,
Yes.
that were based on their evidence.
Yes. And the other thing is, I think we have a good, set of guidelines, practical clinical guidelines. Therefore, most of the time, they are being monitored through different mechanisms. So I think that there is no huge issue regarding this. Socially acceptable methods. What do you think? Sri Lanka acceptance of the primary health care, is it an issue or deficiency?
It's a issue, sir, because according to the literature, the bypassing is the only 30% of all clinic users attended to the PHCs. Others are going
that's
secondary.
very, yes, that's important. So it's important, this is a deficiency, so then there is some issue regarding the acceptability of the community. So the deficiency may be the responsiveness, or because we know that though there are the medically qualified or MBBS qualified doctors, the people bypass them. Maybe due to some other reasons, maybe due to there is no investigation facilities, maybe there is no consultant there, but we need to, there is a deficiency for us to give or the service deliver the service at this PMCU and the primary care setting. So there's a deficiency. So you had to write that. The technology, how about the technology? Do we have adequate technology at all the places? So any deficiencies?
No,
Like,
Facilities not there mostly. Laboratory
Okay,
facilities are
laboratory
lack.
facilities. Yes, lab facilities is a issue because we have seen that most of the bypassing has taken place because they think that there's no facilities to do the lab testing, and most of the time because this is single man station, so we don't have facilities to do the lab testing at PMCU. Right. So the technologically there are deficiencies not only lab but also other facilities like X-ray, or the ultrasound scanning, and sometimes other technologically required facilities may not be available. We'll discuss because that's why I just asked what is part 2. We can discuss how you are going to contribute to these the gaps. So you can discuss how you are going to do the improvement in the second part. Okay. What else? What are the other deficiencies?
The main thing is the human resource.
Yes. Human resource is what is the deficiency? Is the human resource
Because
when you are talking
we
about
are
human
talking
resource?
all the time. We are talking. They are bypassing. They are not getting the service. But whether we are giving the appropriate services through appropriate human resource.
Right.
Some
Good. Yes.
Nutrient distribution.
Yes. Yes. The human resource can අපි කතා කරද්දී මොකද කරන්නේ? Right person, the right right category, right number at
Right place.
right place at right
Right.
time නේ. එතකොට අපිට දැන් ඔය maldistribution එක කතා කරද්දී right number තියෙන්න පුළුවන් at right place right time එකේ නැතු යන්න පුළුවන් නේ. So the maldistribution is an issue. We have seen that most of the time the urban settings that the OPDs in the urban setting, there are overstaffing, and while the peripheries will get the lack of human resources. Yes. So what are the other deficiencies? And it's better if you can go through all, yes, according to the definition, as well as 6 building blocks of the health system. Health system 6 building blocks වලින් එන deficiencies මොනවා හරි තියෙනවද කියලා මෙතන බලන එක හොඳයි. Policy and governance leadership, එක දෙක HRH, health financing, then supply of essential medicines and consumables.
vaccines.
Yes.
That
And
is the
yes.
essential the
Information
supply,
system.
uninterrupted supply of timely
Yes,
supply of
yes,
drugs
we
and
have seen that a lot of time in a given year. In many times we have seen OS drugs in the primary care setting. So do we have essential list of drugs?
yes.
Okay. Oh, එනිසා essential list එකවත් අඩුතරම තියෙනවා නම් හොඳයි. නමුත් එහෙම නැත්නම් ඒක ප්‍රශ්නයක්. ඒ හින්දා ඒක deficiency එකක් විදිහට අපිට ලියන්න පුළුවන්. The other thing is මොනවද දැන් අපේ හයේ තියෙන්නේ අපි ගත්තොත් මුලේ ඉඳලා ගත්තොත් ඊළඟ ඒවා මොනවද HRH එක ඊට පස්සේ අපි ගත්තොත් health information systems and then the health
Service
delivery
delivery.
system. Yes, that's right. Oh, how about the now ඔයාගොල්ලෝ ගියා මෙතන deficiencies බලන්න මෙතන තියෙනවද කියලා බලන්න. Yes, මේ වල තියෙන වලින් අපි කල්පනා කරා whether there are deficiencies. Yes. හරි. Then අපිට තියෙනවද governance, the policy and governance and leadership එක structure එක හොඳයිද for the primary health care? Is there any deficiency?
No, accountability is very much lack.
What do you mean by accountability?
It implies the feasibility of regular review of financial records, numerical transparency.
Okay. So the primary
That's
health care.
accountability.
Yeah, Hari. Okay, okay. So how do you link this to primary care?
It is a characteristic of a PHC, sir. They have to do.
Right.
Yeah.
Okay. No, I'm asking in Sri Lanka, Puta. Sri Lanka, where you are going to direct link this one?
RDHS.
Now, who is the responsible person in the primary care now?
I see.
MO in
I see.
charge.
I got it.
MOIC.
Okay.
MO
Is the one who
in
is
charge.
responsible for that.
Yes, MOIC. Right. Okay. Good. Then, is there any deficiencies in the policy and governance structure?
And
I feel overall, in Sri Lanka, policy and governance structure, we have the universal health coverage policy. We have what called essential service package developed. We have developed a list of essential drugs. We have developed, we have identified the health delivery model as the cluster care system. And basically, the policy level, we are all done, I think. What do you think? What's your opinion?
Yes. Yeah,
So then
policy.
better, yes, it's better if you can show this, that these things are all right. Then if you can come into the HRA, as you said, yes, maldistribution is there. And also, අපි train කරන්නේ මොනවටද during this our medical student time, you train කරන්නේ for what? To do the cardiac
clinical
surgery,
work.
neurosurgery, likewise, no hi-fi stuff ne අපි ඉගෙන ගන්න ගොඩන්නේ, but we have not been trained in focusing on the primary care most of the time. එහෙම නේද? Therefore, I think there is a, first the number, the second the correct skills, correct knowledge. Do we have this correct knowledge is an issue for all the categories, especially starting from doctors. So, and correct skill mix is important. As you said the other day, that correct skill mix is, what do you mean by skill mix?
The efficiency of certain cadres, like people, even though the cadre exists in PMC.
Yes. ඒ කියන්නේ අවශ්‍ය කරන ඒ ටීම් එකට අවශ්‍ය කරන different categories නැත්තම් එතකොට හරි mix එක නැහැ කියලා අපි කියන්නේ නේ. එතකොට අපි එතකොට skill mix එකක් තියෙන්න ඕන. එතකොට ඒක අපේ lacking කියලා අපි හිතනවා නේ. අපි ගත්තොත් සමහර cadres නැහැ සමහර තැන්වල. Dispensers ලා නැහැ in the primary healthcare system එකේ. So though the new system has proposed at least 2 nursing officers in the primary the PMCU, still not been implemented. Likewise, there are issues in HRH. So the deficiencies, you need to write one thing, this thing, then second thing, the HRH. Third one, the financing. Yes, health financing. What do you think? Health financing. Health financing or primary care proportion ekai. The proportion is spent for the tertiary care services. What do you think?
Huge discrepancies there.
Yes, I think so, because you need to write. We have seen that the worth of the MRI machine, right? Or another cat other hi-fi or investigation machines වල ගණන් බැලුවොත් ඒ එකක් දෙකක් ගන්න තමයි අපි බලන්නේ හැම වෙලාවෙම. That's good, that's really neat, but still we need to know that primary healthcare is an efficient service. What do you mean by efficiency? You know that how much we get for the given inputs. නේද? ඒ නිසා efficiency improve කරන්න ඕන නම් we need to improve the primary care. ඉතින් primary care වලට නමුත් දෙන කාටත් පේන්නේ නැනේ. So the politicians, their their interest on the primary care is very much less, because they can't open it up saying that we have donated or we have given so much worth MRI machine to this hospital and that hospital. So they have not been advocated properly to understand or identify the importance of the primary care. Therefore, I don't think that the financing, health financing is equally or equally නෙමෙයි කොහමද නිවැරදි විදිහට dispute වෙලා තියෙනවා කියලා for the primary care. So the health financing, there are deficiencies. What else? And
the other way around,
yes.
so the other way around also we can tell, like because out of pocket expenditure of the country is so high, if the primary health care is established in a better way so that the people might come to the services, so out of pocket and catastrophic health expenditure might go down.
Yeah, that's very good. Why we need to improve the primary healthcare services is to reduce the out of pocket expenditure of the community. As usually, around what percentage is out?
46.5.
Yes, it's somewhere around 46 to 50. But
45.6.
but එතන තියෙන වාසිය තමයි though the high එතන පොඩි tricky point එකක් තියෙනවා because though the out of pocket expenditure is such high, but the people going for a catastrophic health expenditure is not that high. එහෙම නේද ලංකාවේ? That
Catastrophic
indicates
expenditure also increased from 2000 to
The
2019, sir.
recent values
US
it's
dollar
going up.
44 to 160 US dollar.
100
160
Yes, sir.
US dollar 2019, around 40 in 2000.
Now
හරි
the
දැන් මං
middle and the lower levels are also getting into the higher out of pocket expenditure category. So
අලුතෙන්. All right. Okay. Because I heard the මට මතක හැටියට තිබුණේ හැටියට catastrophic expenditure for health is not that high, though the out of pocket expenditure is high because the upper may quantile of the wealth category is going to the private sector කියලා. Okay, if not right, we can write it as well. So what is the deficiency in the system that we identify there?
If we ensure the essential drugs and investigation available in the primary healthcare, sir, we can reduce the out-of-pocket expense.
Right. Okay. So what is the deficiency then identifying?
So
Because now
if if we are ensuring the primary health care, so the financial risk protection, the financial the amount that people have to pay for the get the health services
okay,
will go
right.
down.
Yes. True. No, I'm asking then අපි මේක අහන්නේ deficiency එකක් විදියටනේ. ඒතර ඒ deficiency එක විදියට ඔක ලියන්නේ කොහොමද උත්තර ලියද්දි?
Continuity of care deficient.
Okay. දැන් අපිට කියන්න තියෙන එහෙමනම් so therefore the අර ටික කියලා අන්තිමට අපිට කියන්න වෙනවා අපේ system එක is not efficient enough to capture all the people who need the care. නේද එහෙමනේ?
Yes.
Because it's not one reason why they are not coming for us. Maybe the accessibility, maybe
gatekeeping is
the
not there.
huh?
Gatekeeping is not there.
Yes, gatekeeping is not there. Yes. No, I'm asking දැන් ඔයගොල්ලෝ කිව්වනේ catastrophic expenditure, yes. Out of pocket expenditure. Oh. So මේ ප්‍රශ්නෙට උත්තරේ ලියන්න ඕන deficiency එකක් විදියටනේ. So then what is the deficiency? I feel if I'm going to write this answer, I will write the system is not efficient to attract the people who need the care in the health state health sector due to many other reasons like responsiveness, like lack of facilities, like lack of the facilities and so on and so forth. හරිද එහෙම ලියන්න පුළුවන් නේද?
Yes, sir.
Right. Okay. Then I think deficiency is that, and another
The
deficiency
resilience, lack of resilience in the system,
is, what do you mean by resilience, Tahir?
because in like situations like when there are some COVID-like emergency situations.
Okay. So what happened to our system? So what do you think? Then now you have to critically think in our system එක හිතන්න ඕන. හිතලා අපේ එක disrupt උනාද නැද්ද disrupt උනේ reasonably විදිහටද නැත්නම් what do you think? What's your opinion?
Because of there was no lack of private public partnership. I think because of that, in that sort of a pandemic there was lack of resilience in the system. So we had some problems. We need to
Okay.
encounter those.
Right. Okay. Right. You can write it. But my personal opinion, personal view is our system is resilient, and we have the search capacity also. But what happened was the decision taken by the senior authorities at that time, I think affected the system to disrupt the normal service delivery. But because when we were filling this මොකද්ද අපේ සාරාද නෙමෙයි අනිත් එක අපි පිරේ මොකද්ද disruption බලන්න පිරෙව ෆෝම් එකක් තිබුණේ. So ඒක පුරවද්දී අපි දැක්කා එහෙම දැන් අපි මේජර් සර්ජරි දැන් මේ පැත්තේ කරොත් ඒ අපි તો ඩ්‍රග්ස් ටිකට මොකද උනේ ඩ්‍රග්ස් බෙදුවද කොහොම හරි ක්ලිනික් තිබ්බේ නෑ ඩ්‍රග්ස් ටික බෙදුවා ලැබ් සර්විස් තිබ්බේ නෑ මැටර්නල් කෙයා දුන්නා වැක්සින් ක්ලිනික්ස් තිබ්බා මොකද උනේ ටික ඒ නිසා මම හිතනවා disruption is yes to a certain level මම අගේ නිකන් හිතනවා the resilience is to a certain level comparing to other countries our system is robust enough but yes there can be some deficiencies in the resilience as well. Okay. How about the what do you think? Are you satisfied with the healthcare delivery system in the primary care? What is the system now? Do we have a proper system here? Is it efficient?
There are some deficiencies.
Yes. Do we have the proper the referral system? Do we have the
Referrals and
proper
back referrals and gatekeeping and
gatekeeping?
all
We
the
don't.
OPD facilities like imaging, mental health care, specialized
Yes.
care.
We don't have, right? We are not having a, therefore because some of the hospitals they have the facilities and the some of the other hospitals they don't have. Therefore the closest hospital the people cannot access for the package of services the primary care package of services cannot be accessed to the to these people in each and every hospital because there's health inequality in distribution of because most of the time that's why the people bypass this hospital and going into the base and the above hospitals. The more of the indirect cost also for the health seeking behavior increasing because of the travel cost and loss of wages and so on and so forth. Okay, I think therefore the system is lacking a proper primary care doesn't have a proper health delivery system. Third one, health information system. Still, we don't have a proper information system. The other one is අපි පහමයි essential medicine and consumers. ඒකෙත් issues තියෙන නිසා 5 deficiencies. Can we write 5 deficiencies now?
Yes, sir.
Okay, good. I think you can prioritize them and the customized and contextualize them into a real scenario. Not theoretically general දේවල් ලියන්න එපා. මේ real scenario apply කරලා ලියන්න with some examples. එතකොට තමයි ඒකට අපිට ඒ ලකුණු හරියට හම්බ වෙන්නේ. Okay, 1.2. Describe how a provincial consultant community physician could contribute to the strengthening of the primary healthcare services in the province. Okay. කොහොමද ලියන්නේ? Describe. දැන් gaps ලියවනේ. ඔයගොල්ලෝ ඒ gaps ටික fill කරන්න මොන හරි ක්‍රම තියෙනවා නම් ඒ ක්‍රම අපිට යෝජනා කරන්න පුළුවන්. What are the things? Oh, කට්ටියම නිදිද?
Accessibility improvement and the available
හරි accessibility improve කරන්නේ කොහොමද? How are you going to?
um, infrastructure development as well as
Mama, I like if you can, you know, again අර මං කිව්වා වගේ ඒක හරියටම මේ සුද්ධ general වාක්‍ය ලියන්න නැතුව infrastructure develop කරනවා. accessibility improve කරනවා. ඒක ඒවා theoretical ට වඩා මොනවද කරන්න පුළුවන්? example එක ලියුවා නම් තමයි හොඳ. හරි accessibility yes ඒක අපි ලියන්න ඕන. දැන් අපිට කියන්න වෙනවා yes.
Upper card revision and do for the availability of the human resources. Have a proper card
okay දිනේෂන් කාඩ් එක මදිද අපිට දැන් එහාට?
and inequitable distribution which causes the maldistribution of the services.
okay right. එතකොට කාඩ් එකේ issue එක තියෙන්නේ කාඩ් කියන්නේ මොකක්ද එතකොට? දැන් කාඩ් එක තියෙනවා උදාහරණයක් විදියට card approval තියෙනවා for one MBBS doctor for all the PMCs නේ in Sri Lanka. එහෙම තියෙනව නේද?
Yes. Other hospital, district hospitals also, because included there. Some of the hospitals are having the maldistribution when we go to the suburbs, outskirts.
yes. එතකොට නෑ මං අහන්නේ ඒක කාඩද ඒකේ issue එක තියෙන්නේ maldistribution එක issue එක තියෙන. card is different thing නේද? card approval කියන්නේ
Yes.
government has
The appointment.
identified their
Giving the appointments. We have
yes
to
giving the appointment and the transfer system නේ transfer scheme එකේ සහ appointment දීමේ තමයි ප්‍රශ්නේ තියෙන්නේ. and rural retention එකට අපි මොනවත් කරලා නැතිකම නේද? the rural retention කියන්නේ global issue for the global issue for healthcare workers. So what we have done for the rural retention. So as a CCP, if you can improve some of the factors which lead to the rural retention or which hinders the rural retention, අපිට මේ එක කරන්න පුළුවන්. For an example, අපිට මොනවද ඒකට කරන්න පුළුවන් එකක් එතකොට දැන් අනිත් එක හිතන්නත් ඕන as a CCP here, right? CCP means you are technical head, not the administrative head. Yes, you can give some advices and your opinion to the administrative head, but CCP level again there are much more that we can do. Therefore, it's important to the හරියටම ඔයාගේ answer එක the customize කරන එක CCP ට ඒ වගේම province එකට ඒ වගේම gaps ටික identify කරන්න in realistic way නේද? මොනවද ආට කරන්න පුළුවන්? දැන් I'm as a CCP planning going to Anuradhapura for the province of the North Central province. What are the things that I can do? So what are the things in my span of control or the circle of control? And what are the things I can do my influence of control එකෙන් කරන්න පුළුවන් මොනවද? ඒත් ඒ වගේ ටිකක් realistic පැත්තට වැඩිපුර වුණොත් මොනවද අපිට කරන්න පුළුවන්? දැන් මේක සුසි මැඩම් වගේ දාව ප්‍රශ්නයක් නම් අනිවාර්යයෙන්ම ඔයගොල්ලෝ ලියන්න වෙනවා අර ටික මේ මොනවාද cluster approach එකට support කරන හැටි ESP එක implement කරන්න කරන හැටි දැන් ESP එක ලංකාවේ ESP approved essential
Yes.
service package yes එතකොට ඒක implement කරන්න අපිට කොහොමද අපි primary care එකේ implement කරන්නේ එතකොට policy එකෙන් අපි agreed අපේ health care delivery system එක shared care cluster model කියලා
Yeah. Yes.
yes එහෙමනම් the policy එකෙන් අපිට given direction එක දීලා තියෙන දේවල් we can implement නේ in the how are we going to implement එතකොට එකක් තමයි
CCP can do advocacy on those aspects.
yes advocacy to whom
Low level advocacy to the MOIC and
on what
implementation
Now,
of the policy
ESP.
and yes.
ESP එක අපි හිතන්නේ ESP එක කියන්නේ මොකක්ද? Do you know what do you mean by ESP? Yes. What is the ESP? Is the package of services which need to be provided by each and the category of the delivery points වලින් service delivery කරන services ටිකනේ. එතකොට MOIC ට අපි advice කළා කියලා he is not in a position to implement it if it is not a service which is already been established in that particular PMCU. He is not in a position to newly start this particular service unless he's been enabled with other supportive infrastructure development. For an example, if I take this example of the taking blood for or screening for diabetic in primary care setting. Suppose that particular primary care setting is they are not providing this service. Now, what do you want for this particular primary healthcare setting to improve the service? One, you need to think the infrastructure, whether you have a place or to there's some people, 50 or 25 people, the waiting space තියෙනවද? එතකොට පොඩි තැනක් තියෙනවද ලේ ගන්න? ෆ්‍රිජ් එකක් තියෙනවද? ෆ්‍රිජ් එකට කරන්ට් එක තියෙනවද? එතකොට ඒ ටික අපි බැලුවා. So the infrastructure is important. So then you need to see whether there is a person to draw blood, the phlebotomist activity, who is going to do. Whether this and then advocacy and comes, whether we can ask whether the MOIC or the manning doctor is willing to do this the phlebotomy activity, right? And is there a place to keep this? And is there a lab? Are we going to have a cluster or the satellite lab system or collection system, sending the collecting this blood and sending report through mail, and you are going to print the report at this the service delivery point. Then do we have the computer, internet, and everything? So you have this infrastructure. Then you need to identify the capacity required. So you have a minor staff, or you have a attendant who has some sort of a training, and you will take the the permission from the high authorities to train him as a phlebotomist, and giving the until the such staff comes, he will be doing the phlebotomy activity. So then you need to understand the capacity building requirement. Then you have to identify the required consumables and this particular service. You need a syringe, you need the cotton wool, you need spirit, you need bottles or whatever. So then annual requirement of this consumable for that particular service. Then you need to understand what is the health information system. So whether there is a manual system or are you going to implement a digital system. And then so guideline and protocols. Do you have a protocol in the national level how to do this, how to do the blood, taking blood and doing screening for diabetes. Likewise, if you take one simple service, you need to improve all the 6 aspects of building blocks plus infrastructure. Therefore, as a CCP, you can understand, you can identify these gaps, and ESP operationalization or implementation of ESP can be supported in an identified cluster or identified PMCU. Put in your effort or paying your attention to all the aspects of 6 building blocks of this particular service. No, just advocating, just training, and just buying some equipment or chairs or something will not end up as having a new service. In the planning, what will happen is, if you do not plan for all the component of this particular service, you will not get the end result. Therefore, it's important you to say that if you are going to implement the ESP, you will pay attention to all the aspects of the healthcare building blocks. One. The second, yes.
So in this question, can't we take it as a holistic thing? Because rather than considering one locality, the CCP planning is overall overlooking the province so that when she's doing the budgetary allocations, she need to think about all the needs in the province setup, and when she's doing the strategic planning, so she need to take all the things and the advocacy and stakeholder identification and advocacy to the higher authorities like governor and all like that. Can we write?
That's you can write පුතා. That's මං කිව්වේ ඒකයි. එහෙම ලියන්න පුළුවන්. දැන් ඔයා දැන් CCP planning නම් I will share a document later. I have the document, the roles and responsibilities of CCP කියලා we have නේ අපිට තියෙනවා job description එකකුත් තියෙනවානේ, and we have එතකොට ඒකේ ඔය සේරම ටික තියෙනවා. ඒ කියන්නේ policy level, strategic planning, advocacy and technical head of the province. Therefore you need to understand the gap, you have to identify the gaps and so on and so forth. But my understanding is yes, ඔයා ඒ ටික කොහොම ලියන එක හොඳයි. ඔයා පටන් ගත්ත කියන්නේ ඔය ටික ලියලා. My understanding is මේක කතා කරන්නේ primary health care strengthen කරන්න. හරි. At your province primary health care තියෙන්නේ ඔයාලගේ කොහෙද දැන්? Primary health care තියෙන්නේ PMCUs and DHS and the base hospital එකේ ඒ ටික. If the cluster system is shared care cluster system is implemented, then yes. If not, individual primary health care setting will act as a service delivery point. එතකොට මට හිතෙනවා මේ primary care එකට අර budgetary allocation කරන්න අපි කරන එකත් strategic planning එක advocacy කියන එක ලියන එක හොඳයි. හැබැයි ලියුවට මට හිතෙනවා ඊට වැඩි ලකුණු අපිට හම්බෙන්න ඕනේ. අපි කිව්වොත් එහෙම I as the CCP planning will take action to implement the ESP in the selected PMCU. Implement the selected services in the ESP in selected hospitals. For that, yes, I will allocate the adequate amount of funding. I will do the procurement according to the requirement of this particular service. For an example, if you want some the waiting area in this area in this particular hospital, so you need some gang chair, so you will do the procurement. And if you want the 5-part analyzer, or if you want hematological analyzer, or if you want if you want any other analyzer in the cluster lab, so you will put into the procurement annual procurement plan. Likewise, you can say according to that I will allocate funding. I will do the capacity building කරන්න වෙන්නේ ඒකටනේ. එතකොට මම gap එක identify කරනවා. එතකොට ඒ capacity building එක කරනවා. එතකොට මම හිතන්නේ එහෙම අපි හරියට focus කරලා applied විදිහට ලියන එක වඩා you will get more marks rather than just writing overall like the allocation of money, advocacy, because they are very general. I will share this document so everything is there, because it's applicable for strengthening the primary care. It's applicable for if you think apitano dengue prevention, එහෙම නැත්නම් අපි ගත්තොත් මොනවාද occupational health and safety, ඔය හැම එකකටම advocacy ඒ ටික applicable නේ. හැබැයි මම කියන්නේ primary care එකට කොහොමද ඔයා CCP planning විදියට වැඩ කරන්න කියන එක වැදගත් කියලා මට හිතෙන්නේ. ඒ නිසා අරක ලියන්න, but ඒකෙන් කොහොමද ඒක සිද්ධ වෙන්නේ කියලා ලියන එක වැදගත්. Okay? හරිද? Right. අනිත් එක මට හිතෙනවා, so you don't have adequate number of ඒ නිසා ESP operationalization is important. දෙවෙනි එක, you can try the agreed upon service delivery model, which is called මොකක්ද අපි කියන්නේ ඒකට shared care cluster model එක. ලංකාවේ කවුරු මොනවා කිව්වත් දැන්ට agreed එක. ඒතර ඒකට අපි මේක අපි try out කරනවා කියන එක අපිට ලියන්න පුළුවන්. shared care cluster model එකේ මොනවද improve වෙන්නේ? resource the sharing improve වෙනවා. ඒ වගේම the efficiency improve වෙනවා. ඒ වගේම අර වගේ කතා කරපු සමහර තැන්වල නැති සර්විස් එකක් පොදු තැනකින් අපිට දෙන්න පුළුවන් වෙනවා. like the lab services. ඒ නිසා අපි ඒක improve ඒක අපි implement කරපුවාම ඊළඟට referral and back referral system එක improve වෙනවා. gatekeeping role එකකුත් එනවා because ESP එක sorry the essential health service නෙමෙයි. මොකද්ද අපි කිව්වේ the cluster model share එකේ cluster model එකේ පළවෙනි එක empanelment දෙවෙනි එක registration තුන්වෙනි එක එද්දි තමයි service delivery එක වෙන්නේ. එතකොට අපි phase wise අපි all the services in the ESP can be implemented ටික in the cluster. උදාහරණයක් විදිහට if you don't have the dietitian or dietary counselor, only one counselor is available in the Apex Hospital in the shared care cluster model, right? So how you can improve his availability or his because එකයි ඉන්නේ අපිට එතකොට අර කෙරවල කියන්නේ 100ක් විතර එන එකකට කියන්න බෑ ඇවිල්ලා මේ මෙහෙට ඇවිල්ලා dietary the advice එකක් ගන්න කියලා. So how are you going to improve these service in the primary setting to make available his services to the other areas efficiently? Only one is available.
Appointment system.
But still, then these people need to come all over the all the way from these 100 kilometers away.
Telemedicine, sir.
Yeah, telemedicine and digital health is the very good solution. So you can say, I will establish a counseling chamber in each and every the hospital. Oh, hari man kiyanne එහෙම. ඒත් ඒකේ ඉන්නේ ඔයත් ඇතුළට යනවා අරක ඉන්නවා so that you will do the telemedicine part. So you will give අර මනුස්සයාට දෙනවා ඒ දවස් 5ක් හරි 4ක් හරි sessions 4ක් for this areas වල ඒ counseling කරන්න. ඒ නිසා telemedicine improvement එක කරොත් ඔයාට ගොඩක් staff needs and resource needs අඩු කරගන්න පුළුවන්. What else? How are you going to improve the services within short term? තව කොහොමද අපිට improve කරගන්න පුළුවන්?
The satellite clinics, sir.
Satellite clinics, yes, satellite clinics is another way. We can improve the satellite the services of available resources, available experts. Yes, likewise, මං හිතනවා CCP කෙනෙකුට generally අපිට කරන්න පුළුවන් දේවල්. Yes, ඒ නිසා specifically ලියන්න වෙයි ලංකාවේ නිසා ESP plus operationalization and how are you going to address the HRH issue here and how are you going to optimize the available HR by satellite clinics and by the digital health and the what called telemedicine and ATA Kiandavi. Then the capacity building. So you will do the proper gap analysis for the capacity building and you will conduct the proper capacity building program relevant to the service delivery. Not haphazard, not general list, but this capacity building is for particular activity related or the job related capacity building which has a particular identified contribution to the එහෙම නැතුව නිකන් රට ගිහිල්ලා එන්නවත් නිකන් කාගේවත් workshop එකකට ගිහිල්ලා එන්නවත් නෙවෙයි. Identify the contribution from that particular capacity building. මං හිතනවා ඒ ටික ඔයගොල්ලන් ලියා ගන්න පුළුවන් නම් අර ජෙනරල් ඒවට අමතරව හැම වෙලාවෙම දැන් මෙහෙම වචන දුන්නාම as a CCP planning. ඔව් CCP planning තමයි. එතකොට එයාගේ රෝල් එක අතර තියෙන්නේ අතන පළවෙනි ජෙනරල් ටික ලියන්න ගැටලුවක් නැහැ. මට හිතෙනවා ඊට වඩා ඊට යටින් අපිට දැනට ගවර්න්මන්ට් දැන් අපි එයා තමයිනේ CCP planning province එකේ ඉන්න එක්කෙනා තමයි the bridge between the provincial system and the central system. He need to understand the central level එකේ තියෙන policy directives and the strategic needs of the national level where the implementation to be taken place in the provincial level. Therefore, it's important to bridge the gap between the national and the central and the provincial level using the තියෙන දේවල් අපි operationalize කරන්නේ කොහොමද ගමේදී කියලා. ඒ හින්දා තමයි the national level එකේ දැනට තියෙන agreed එහෙම නැත්නම් policies how are you going to implement in the primary care? So the primary care policy ke shared care cluster model. ESP is the agreed upon service package. Therefore, how you are going to facilitate to implement these things in the primary care setting what are important, and how to address the HRH gap and inefficiencies inefficiencies in the HR, and also maldistribution and so on and so forth. If you have time, you can write some things how you can improve the retention. Retention improve කරන්න බැරි එක හේතුවක් තමයි quarters. නේ rural retention. ඒතර quarters වලට allocations දාන්න පුළුවන් quarters හදන්න. ඒ වගේම අවශ්‍ය පහසුකම් දෙන්න. ඒ වගේම ඒ අයට අවශ්‍ය transport පහසුකම් ලබා දෙන්න. Likewise, how you are going to improve the rural retention is important. And ඒ වගේ අපිට මම හිතනවා වඩා ටිකක් අරකට applied focus උත්තරය ලියනවා නම් හොඳයි කියලා. Okay, now 11:30 and so any other option for this, any other opinion for this question? No, right. So we are going to stop today, Dineshan.
Sir.
Yes, but now how many of you have written these two questions now?
We have written for the 2019 third answer.
Hari 2016 February question 4 නේ මේක ලියලා තියෙන්නේ නේ.
Yes.
2019, yes.
සේරම දෙනා
Most of them, sir.
most of us, right. So can I have another time රැයට උනත් කමක් නැහැ මේ වෙලාවට?
Right, okay, sir.
හරි.
Yes.
And මේ දෙක විතරද අපිට තියෙන්නේ?
Sir, there are some few other questions also in the.
හරි එහෙනම් මේ ක්‍රමයේද හොඳ, or else are we going to read someone's answer and comment on it? How are you going to, how do you think? What do you think?
This way is good,
This is
sir.
good.
ඔව් ඒතර අහගෙන ඉන්න විතරනේ තියෙන්නේ නේ. හරි. හැබැයි එහෙනම් සේරම ලියාගෙන ඉන්න ඕන. මම දැන් ඊළඟ දවසේදී I want to check all your questions. නැත්නම් වැඩක් නැහැ. අහගෙන හිටියට ඔක මතක හිටින්නේ නැහැ. මේකට අඩුතරම sketch එක වගේ දාගෙන ඉන්න ඕන හැමදේනම, right? Can you do this?
Okay, sir.
Just a sketch, right? One page sketch එකක් දාගන්න. All of you, right? All of you ensure that all of you have at least done the sketch. So we'll have a quick chat, then complete these two, right? And Dineshan, is there any other questions? So let me know.
Sir, there are few other questions, sir. I have sent them to you, sir. Shall I show it them, sir, now?
Ane, please, please.
These are the
Program evaluation, right? I think one program evaluation එකයි.
for 2021, sir. We have written the answer and send it to you, sir.
Right, okay.
One
Completion multi-sector. Right. Hari.
we have written for the 2015 answer, sir. And we'll
Hari,
put
okay.
other parts.
හරි හරි. දැන් අපි පොඩ්ඩක් වෙලාව ගත්ත වැඩි කියලා හිතෙනවා මට මේ ඩිස්කෂන් එකට. ඒ කියන්නේ අපිට දෙකයිනේ කතා කරන්න පුළුවන් උනේ. Any efficient way of utilizing time? Any suggestion? පුතේ ඔකට කියන්න මම මීටින් එක කියලා කතා කරන්නම් කියලා ඒ ආන්ටිට. දැන් Yeah. Okay. Yes, any other way of මොනවා හරි ඊට වඩා අපිට කාලය ඉතුරු කරගන්න ක්‍රමයක් තියෙයිද? Or do we need this sort of a description, or are we going to just discuss the points, or how do you feel?
This is good, sir, because the first two questions we had a lot to discuss, but usually repeatedly they are asking similar type of things.
Similar
So
type of questions.
that
නේද?
makes
Yes, yes.
sense.
හරි එකක් දෙකක් එහෙම කරන
We
එක
will
worth
not have
30. Right. Okay. කාලේ ගියත් එකක් දෙකක් එහෙම කරන එක worth නේ.
oh,
Okay, right. එහෙනම් ඔයගොල්ලෝ ලියන් එන්න දැන් මෙයා පෙන්නපු පිළිවෙලට අපි ඩිස්කස් කරගෙන යන්න. මේ ඒ නිසා at least first two questions ටික first 2-3 questions ටික අපිට ඕන දිනේෂන් නේද දිනේෂන්?
Shall we start from 2021 onwards and go backwards?
Right,
To-
okay, okay, no issue, no issue. Right.
Sir,
එහෙනම් අපි පටන් ගන්නේ මෙතනින්ද?
Yes, sir.
Oh,
There are two other questions also in the human resource management. Then after
right.
that,
What is that?
start the other
The
two.
other හරි හරි අරක තිබිච්ච දෙක නේද? දැන් ඉස්සෙල්ලා එක තිබිච්ච දෙකනේ.
Oh, sir. Then
හරි
the,
හරි. Okay.
it goes like this, sir.
හරි
From
හරි.
21 to downwards, sir.
හරි 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 හරි. Okay. Okay. එහෙනම් මට වෙලාවක් කියන්න පොඩ්ඩක් ට්‍රෑ නම් ලොකුවට මට ගැටලුවක් නැහැ. ඒ හින්දා වෙලාවක් කියන්න ඔයගලන්ට පුළුවන්. අනිත් එක මේ වැඩිපුර කල් ගන්න නැතුව ටිකක් ළඟ ඉවර කරන්න වෙන්නේ නේ ඔයගලන් පාඩම් කරගන්නත් එපා.
Yes, sir.
අනිත් එක මේ අපේ තව කවුරු හරි ඩිස්කස් කරාද ඔයගොල්ලොත් ඒ questions?
Sir, economics kara Anuji madam ek kara.
අනුජි කරාද? මේ හරි. Okay. If
Himali
if
madam
you want any howද?
Himali madam. Himali
හරි 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 හරි. Okay, okay. හරි දැන් මේ සුමල් කතා කරලා කියපු ටික මේ ටිකනේ දැන් මට මේ සර් කතා කරලා කිව්වේ
small certificate
මේ ටිකනේ හරි හරි. Okay. එතකොට මේ අපි HR ටික කරේ මේ අපි සර් එක්කනේ නේද? අපි පාල්සර්ත් එක්කනේ. කවුද කරේ? ඉෂානි මැඩම්ද?
නෑ පාලිත සර් තමයි මේ පූජානි කතා කළා පාලිත සර් කිව්වම තමයි පාලිත සර් කිව්වේ මේ සර්ට කතා කරලා කියන්නම් කියලා human resource ටික කරන්න කියලා.
right right okay okay හරි හරි එහෙමනම් අර විදිහට දැන් ඔය අපි දැන් ඉස්සලා පේපර් එකේ පෙන්නපු එක ඉතුරු HR දෙක ඉවර කරලා ඒක ලේසි මොකද ඒක හරි මේ මම හිතන්නේ මේ ඒක හරි forward මේ අපි කෙලින්ම කතා කරන්න පුළුවන් දෙකක් තියෙන්නේ CCP ගනේ ඒ හින්දා අපි ඒක කරලා questions ටික ඉක්මන ඉවර කරන්න බලමු හරි okay but I want to see all of your one page right.
Okay, sir.
Okay, right. Thank you, right. Okay,
Thank
then
you,
good
sir.
night. Okay, good night.
Thank you.